know that there was reports of Omicron variant being found in Alabama. It was not our lab that kind of found this, and any questions kind of regarding the variant and its prevalence in Alabama, we ask that you direct to the Alabama Department or ADPH at this time. Please drop your questions in the chat, or you can ask them directly by raising your hand using the reaction function. And we are going to go ahead and kick it off with some questions. Dr. Dye, many parents are worried about seasonal illnesses on top of COVID. Can you get a quick overview of symptoms of the common cold versus RSV versus COVID and what parents should look for?
So I think initially you can't tell the difference. Symptoms can be mild to extreme, and depending on the age of the child, but initially it may all present very, very similarly. And so, until you're tested, you don't know.
All right, thank you. As a follow-up to that question, do symptoms kind of present differently in kids of different ages, maybe your older adolescents versus your younger toddler age?
Yeah, so typically we think of RSV as being more severe in the much younger, newborns, infants, and those early toddler. But really that less than 1 year of age is when it certainly is more severe. And then certainly if they any of these illnesses, common cold, anything can present more severely in the younger age, and especially if they have pre-existing conditions or premature, or have had lung diagnoses or issues up until that point.
All right, this next question is from Shalina. Are you worried about any hospital surge? How likely is that with this variant? And I'd like to add, also as well with RSV or flu, since we did see a little bit of an RSV surge this summer in Alabama.
I think in the pediatric population, and as far as our volumes, I kind of feel like we've been surging since this summer, and it's kind of gone up and down a little bit, but we're certainly experiencing higher volumes than we ever have, and in the hospital, but even in the outpatient realm as well. And just with it being now what we would really consider our typical winter, getting into the winter virus season, certainly do anticipate even more volumes of sick kids, seeking treatment.
All right, thank you. And we've got a question from Chip. Everyone's been hearing some reports that the variant is resulting in more pediatric hospitalizations in South Africa than any other variant during the pandemic. Is this a concern here moving forward?
I think until we get even more vaccinated, those that are eligible, please get vaccinated. But until more of the population is vaccinated, we're going to continue to see variants and continue to see worsening outcomes, or worsening transmissibility, more severely, more rapidly transmitting with those variants.
Speaking of vaccinations, another questions from Shalina. We are fairly behind on vaccinating kids. Kind of what do you believe is going on, or what are you seeing maybe with vaccine hesitant parents?
I think just in general, everybody is behind on taking care of themselves medically. I think especially in my clinic, the primary care clinic at UAB for pediatrics, we, it's very common for patients to come in for their annual visit and to have not been seen in, 2 years. And so there certainly is delay in just routine vaccines. And, with that comes delay in getting the, the seasonal flu vaccine, and then, even, approaching getting the COVID vaccine. So.
Thank you. Another question from Chip about the COVID vaccines. We kind of mentioned that a lot of parents are still hesitant. What is kind of your advice or reassurance to them?
It has been studied thoroughly, and the only way out of this pandemic, which now is endemic, is getting vaccinated. And I would just encourage parents to have a conversation with their pediatrician, with their trusted medical provider. There is so much disinformation out there, and just absolute non-truths, and it's that's what is easily attainable, for most, and so seeking the actual information, the actual truth, and being able to have that open conversation with your medical provider is hugely beneficial, just to really know what your concerns are, and and until we dig down into that, we're not going to be able to make progress. So just to be able to, on both sides, to be open to that conversation, and to really ask those questions and hear one another, so that we can hopefully make some positive steps forward.
Thank you. As we're kind of going into the holidays and people are traveling and gathering, there are still kids who are not eligible for vaccines. What are some ways that families can kind of help protect those who are ineligible during this time?
So continuing to wear masks is hugely important, even if you are vaccinated. If you know that you're with your family, your unit, then certainly you don't have to wear your mask in your own home. But that's right. We don't have it eligible for everybody, and even like we've already said, those that are eligible, not all are getting it. And so there's still that risk of transmission, and even asymptomatic cases, or people thinking, oh well, this isn't COVID or flu or whatever, and just spreading that, and that's scary to those that aren't eligible. And again, that really young population, and the elderly, or anybody that has chronic medical conditions, that certainly is going to be very much more at risk of being very sick and complications.
Thank you. And we know if there are currently any trials for the vaccine for children under 5?
Yes, they are ongoing right now, and I am really, really hopeful that that by the within the next month, that data will be being reviewed, and just praying that vaccine gets the approval in that age group very, very soon.
All right, and kind of going back to vaccine hesitant parents, I've got a question from Pat. You talked about how it's important for parents to talk to their pediatrician and get down to the root of their concerns, but do you have any kind of, I guess, general overarching concerns that you are seeing from parents?
I don't think that there's one thing that is a concern. I think it just people are scared, and if they some of them know somebody that this or that or whatever, and and that's just one extrapolation from it, or they've heard this and believe that, and so it's it's having that conversation, and just really listening and trying to educate, so that they do feel like their questions are answered, and can trust and believe in what, what the science is.
Thank you. Can you also kind of provide us some tips? I know that shots in general are scary for kids. What are some ways that parents can kind of ease their kids' mind, or talk about the COVID vaccine or really any vaccine at this time?
Yeah, I mean, of course, that's, nobody wants to get a shot, regardless if it, what it's for. And so, with my own children specifically, just letting them know that this is protecting them and our loved ones, family that's has much more medical problems, elderly, and being able to be around them, and even their cousins that are their age, being able to really be able to play and see them and be together, but not acknowledging that, yeah, I mean, this is a shot. It's it's a poke in your arm, and it's not going to feel good, but it's a brief poke, and maybe a little bit of arm soreness afterwards, but then you're getting so much immunity and protection to be able to hopefully get out of these masks one day and be able to get back to life.
Thank you. I've got a question from Chip. So we are approaching the 2-year anniversary since the start of the pandemic. How tough it is for doctors, nurses, healthcare workers in general, especially with this potential surge or not surge of this new variant.
That's it. Thank you, Chip, for asking. It's tough. We're tired. We are tired. And our staff is tired from, people, our clinic registering and triaging. I mean, the whole gamut, whether you're, clinical, front-facing, patient-facing, or not. We're tired, and but we are, still working hard and still taking wonderful care of our patients. We all want this to be over, or to come to a point to where it's not, the daily news break, the daily, fear almost, but just to where we can, get back to being able to do things, and to not, have to put on 15 different layers of PPE, just to see a patient, because of what they may have. So
thanks. And I have another one from Chip. We hear common cold, flu, RSV, and you mentioned that at first a lot of their symptoms are very similar, and it can be overwhelming for parents to know how to protect their kids from it all at once. How would you suggest they kind of tackle and or prioritize the various illnesses?
Getting vaccinated, getting your routine vaccines, getting the flu vaccine, and certainly getting the COVID vaccine for anybody that's eligible, and for the family members that are, the parents and so forth that are older, to get those boosters when they're eligible for that as well. And just having your children wear a mask, as bad as all of us don't want to, and good hand hygiene, and there's the normal things that we used to think about more so during this time of year, coughing into your elbow, using Kleenex, washing your hands after you do so, but just really being vigilant about protecting yourself in all those ways that you can, so that hopefully you're not getting exposed, and if you do have something, even if you don't know, that you're not then exposing other people.
Thank you. Well, I think we might have covered everything for today. Let's see. Oh, another one from Chip. Thank you, Chip. a lot of people think that kids aren't impacted severely by COVID, but we have seen kids hospitalized in some instances with COVID, right?
Absolutely.
Right. So we think that's probably it. Do you have any closing statements, Dr. Dye?
I would just say that my clinic, the UAB Pediatric Primary Care Clinic that's in Children's Park Place, is vaccinating for COVID, and it's the Community COVID Clinic, a partnership through Children's, that if you don't have to be our patient to get the vaccine there. You can be, if you don't have a PCP, or if your PCP is not giving the vaccine, then you can go online or call a number that I can give you in a few minutes, but to get an appointment to get that vaccine. So.
All right, thank you. And as a reminder to everybody,